You're listening to the MotherToBaby Podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
Welcome to another episode of the MotherToBaby Podcast. My name is Chris Stallman, and I am a genetic counselor, a mother of four, and a teratogen information specialist. For those of you who don't know, a teratogen information specialist is someone who gives information about exposures during pregnancy, before pregnancy, during breastfeeding, and we also talk about cases of adoption. And by exposure, that can be anything. So it could be a medication, it could be a vaccine, it could be alcohol, or it could be something that you are encountering in your workplace. And that's actually the focus of not only today's episode, but actually this episode is part of a series on occupational exposures during pregnancy and breastfeeding. In honor of National Birth Defects Awareness Month, we have some very special guests with us for these series to talk about these types of exposures. Our first guest is Dr. Jennita Reefhuis. She is branch chief for the Birth Defects Monitoring and Research Branch at the Centers for Disease Control and Prevention, also known as the CDC. She has also worked extensively on the National Birth Defects Prevention Study, which is a case control study that included interviews with more than 43,000 women from 10 states. So, Dr. Reefhuis, we are so excited and thankful to have you with us today.
Thank you very much, Chris. I'm happy to be here.
And we also have another guest. So we have Dr. Carissa Rocheleau, who has worked as a reproductive and occupational epidemiologist at the National Institute for Occupational Safety and Health for 12 years. She has authored 36 peer-reviewed manuscripts, over 36 topic pages on reproductive health in the workplace, multiple government documents, has provided hundreds of consultation to workers, employees, and healthcare providers as a designated CDC subject matter expert in occupational exposures before and during pregnancy, and also during breastfeeding. Dr. Rocheleau, thank you. We're so happy that you could be with us today as well.
Thank you. It's such a pleasure.
Okay, let's get started because we have so many things to talk about. We often will get questions about different types of exposures, including different ways people can be exposed to radiation. So what are some of the common ways people can come into contact with radiation?
Thanks, Chris. I want to start off by saying that radiation is really used to help us live healthy lives on a daily basis. Different types of radiation are found in smoke detectors used to disinfect medical instruments and blood, and are used to perform many other tasks in our daily lives. Our main exposure to ionizing radiation in man-made sources is through diagnostic medical exams, such as X-rays or CT scans, and then, of course, some treatments, such as for cancer. Some occupations may have more regular or higher exposures to radiation, including employment in hospitals, dental offices, animal clinics, and research institutions.
Hi, Chris. And I'd add that flight crew on airplanes are also exposed to higher levels of that natural ionizing radiation from the sun, which we refer to as cosmic radiation. Normally, our atmosphere protects us from a lot of the sun's radiation, but the higher your altitude, the less atmosphere between you and the sun. So the National Council on Radiation Protection and Measurements reports that aircrew have the largest average annual effective dose of all U.S. radiation-exposed workers. And previous research has linked that higher cosmic radiation exposure in flight attendants to increased risk of miscarriage.
It is important to remember, though, that even if you have been exposed to radiation, it does not automatically mean that your baby is at risk for any health problems. And also, if you're pregnant and you've been worried about the safety of those full body scanners at the airport, you can rest a little easier. The millimeter wave full body scanners that are used in most of the airports in the U.S., common exposure to that form of radiation does not seem to pose a risk for pregnant women and their babies.
And thank you for that. That is one of the common questions we get, actually. I mean, we know there's radiotherapy and all these other types, but we have been asked before about, scanners and being a flight attendant. So very, very interesting. So when there are concerns, what are the concerns about being exposed to radiation during pregnancy and breastfeeding?
There have been some concerns raised, but there's not a whole lot of data out there. So
Sure.
One of our reports using data on more than some of those women and mothers from the National Birth Defects Prevention Study, it did show that mothers who were in occupations with potential exposure to ionizing radiation did seem to be at an increased risk for having a baby with birth defects of the brain, ear, and intestines. But with any of these kinds of studies, it is really important to realize that this is only one study, and we really need to confirm these kinds of findings in other independent data.
For those workers who are exposed, there are guidelines on how to protect workers exposed to radiation in pregnancy, but employees must formally declare their pregnancy or their intention to conceive to both their supervisor and their employer's radiation protection specialist in order to trigger those protections. So once an employee who's exposed to radiation has formally declared pregnancy or pregnancy intention, usually an employer will give them a dosimeter that they can wear at their abdomen level, at waist level, underneath any of their lead protective garments to make sure that their dose stays below those recommended guidelines for pregnancy.
And a dosimeter, is that something that will give a reading on the level of radiation someone is exposed to?
Yeah, that's exactly what it does. It just records the amount of radiation that's reaching the meter.
Got it. Thank you. I actually had never seen that word before, so just interested to know. Excellent. Now I know the official name. How does the timing in pregnancy and the dose of radiation play a role in the chance for issues in a pregnancy?
The timing in pregnancy is really important, Chris. The critical period for most birth defects is the first trimester, as I know that you have discussed before on your podcast. Nearly half of pregnancies are unplanned, and even though planned pregnancies, not everyone realizes they're pregnant right away. So women may unknowingly be exposed to radiation during early pregnancy. There's not been a lot of research on the impact of moderate levels of radiation on the developing baby. If a developing baby would be exposed to really large doses of radiation, and now we're talking about doses received from like 500 chest x-rays all at once, during those more sensitive stages of development, so between week 8 and 18 of pregnancy, the health consequences could be severe, especially to the brain of the baby. Again, you have to keep in mind this is based on very large doses of radiation. Exposure to such large amounts is really uncommon.
And are there any special considerations for breastfeeding?
So here it's important to distinguish between radiation, that is the energy beam or wave that passes through a person's body, like when we get an X-ray, and a radioactive particle, so something that's emitting that radioactive energy. Sometimes we use radioactive materials. They're injected or implanted for certain medical procedures. If that happened, a person should talk to their medical team and let them know that they're breastfeeding so that they can get some guidance. Some of those radioactive isotopes are cleared from the body very quickly, but some can last a little longer. So a medical team can advise a patient on whether they should pump and discard their milk for a period of time. But again, this is only for the radioactive particles being introduced to a person's body. With something like an X-ray, the radiation beam, only the energy has already passed through the body, so there's no risk to breastfeeding.
And really, the best advice we can offer is to tell any healthcare provider you see, including your dentist, that you're pregnant or breastfeeding before you get an X-ray or other tests that use radiation, like computer tomography, also called a CT or a CAT scan. And then you and your provider can decide what test or treatment is best for you at that time. I do have to say, in many cases, the risk of an X-ray procedure to the mother and the baby is very small compared to the often bigger benefit of finding out about a possible medical condition. And if you're concerned about radiation at your job, talk to your boss. You may be able to change job responsibilities to help keep you and your baby safe during pregnancy or while breastfeeding.
And I think that's such an excellent point about, what is considered to be a small amount of radiation versus, the reason that you need to have an X-ray. And, it being pregnant or breastfeeding in a lot of cases is not going to be the reason to avoid getting an X-ray that could be helpful to know about for your own health.
Absolutely.
Excellent. Excellent. Thank you. I would love to keep rolling if we can. Thinking about X-rays, of course, there's a lot of ways you can be exposed to those, certainly in the workplace. But actually, I want to shift a little and talk about being a veterinarian or a veterinarian technician. What are some common exposures in that line of work?
Yeah, vets and vet techs may be exposed to ionizing radiation like we just discussed, but then also there's the possibility for animal-transmitted diseases and parasites, and there's certain harmful medications, such as medications used to treat cancer in pets as well.
And I'd add anesthetic gases to that list. Several studies have suggested that anesthetic gases can contribute to miscarriage. Most of these were done later in like the 80s, 90s in hospital operating rooms. And since then, we've developed very sophisticated ventilation systems and waste anesthetic gas scavengers that reduce workers' exposures in those operating rooms. But a lot of times veterinary clinics are much smaller and they don't have those systems in place. So those workers are still being exposed to anesthetic gas potentially.
Yeah, and I just really want to recognize vets and vet techs. We have two cats. We have two children, therefore we have two cats, so that they each can have their own cat. And I really appreciate the work that vet techs and vets do. They work tirelessly in exam rooms and labs and operating rooms. We all know that when there's something wrong with our pet, the whole family is impacted. So I really appreciate how they have to navigate many different potential exposures while on the job. And so I want to really add a big thank you to all the vets and vet techs out there taking care of our pets.
As a fur mom, I will definitely agree. And, vet techs have a hard job because their patients aren't always cooperative.
I absolutely agree with all of that, especially the big thank you. We have a 7-year-old beagle who is lovely and wonderful and not always the best patient. And of course, when he goes in, our vet is amazing and the whole team at the vet's office is amazing. But I'm also very, very nervous when I go in too. So not only the pets that can sometimes be a little bit on edge. So thank you. So thinking about vets and techs, what is the most concerning exposure during pregnancy and breastfeeding in this line of work?
Yeah, we've already discussed the potential effects of radiation, so I'd like to actually highlight an infection that your listeners might not be as familiar with called toxoplasmosis. Cats play an important role in the spread of toxoplasmosis. They can become infected by eating infected rodents, birds, or other small animals, and then the parasite is passed in the cat's feces. So then how humans can be affected is by accidental ingestion of the parasite after cleaning a cat's litter box or after touching anything that has come in contact with a cat's feces that contains toxoplasma. So a woman who is newly infected with toxoplasma during or just before pregnancy can pass that infection on to her developing baby, and unfortunately that can lead to blindness or microcephaly, which is a birth defect where a baby's head is smaller than expected. So if you're pregnant, avoid changing cat litter if possible. If there's no one else who can perform the task, wear disposable gloves and wash your hands with soap and water afterwards, but really try to shift that lovely responsibility to somebody else in your household.
Yeah, and I think one of the exposures that concerns me the most is hazardous drugs like chemotherapy drugs. NIOSH does maintain a list of hazardous drugs used in both medical and veterinary settings and has recommended practices for handling these. And it is so important that every single person in the clinic uses these good practices when handling the drugs to prevent contamination in the workplace. Because some of these drugs, the same cellular mechanisms that allow, say, a cytotoxic chemotherapy drug to zero in on, target, and kill cancer cells will also cause it to zero in on, target, and kill fetal cells. So this is really, really important that everyone is following good practices with hazardous drugs all of the time.
And I'm so glad you brought up that there are, guidelines out there. There's lists, there's information out there. So something that's important to keep in mind all of the time. And along those lines, what kinds of precautions and safety equipment are recommended for vets and vet techs?
Pregnant veterinary staff who are responsible for dealing with bodily fluids from the animals, such as cleaning cages and litter boxes, as I just mentioned, or feces from an infected animal, can consider passing this responsibility to another coworker if possible. Really, all staff should wear thick disposable gloves, protective clothing, and a mask while handling these animals and their samples, regardless of whether they're pregnant or not. And I'm going to say it again, proper hand washing is critical too. I also want to emphasize that although you may work around a potential hazard, it does not mean that you are exposed at levels that would cause problems for you or your developing baby.
Yeah, absolutely. And make sure too, when you're handling those pet medications, when you're getting them ready, make sure to be wearing those safety equipment and washing hands afterwards. And also when handling the bodily fluids of an animal that's receiving a hazardous medication, since a lot of these are excreted out, in urine and feces, make sure that you're wearing protective equipment even then. Another thing I'd like to touch on is respirators. I get this question all of the time. People who are working with anesthetic gases in a veterinary clinic will often ask if they can wear a respirator to protect themselves from breathing it in. And the things I really want them to know is that, number one, an N95 or a surgical mask, what we call a filtering face piece, respirator or surgical mask, will not filter out anesthetic gases. There are some other types of respirators that do work with anesthetic gases, but some of these make it harder to breathe. And pregnancy causes a lot of changes in how we breathe. So it's really important to work with a safety professional and a medical provider to choose the best respirator for your situation. Make sure that you can wear it safely and learn how to use and maintain it. My sister-in-law, when she was pregnant and working as a vet tech, her veterinarian that she worked with got her a respirator, an elastomeric half-piece respirator. And, she started wearing it, and about halfway through surgery, she actually had to stop and leave the room because she felt lightheaded. So that's the kind of situation we don't want to have happening. We want to make sure people have worked with a professional to make sure they can safely wear that respirator. And then the American College of Veterinary Anesthesiologists does have guidelines on how to control waste anesthetic gases. These best practices can really help. So it's things like, make sure if you're masking or boxing an animal, make sure they're enclosed and that mask is in place before you start the flow of the gas and things like that.
I did have a question once from someone who was handling a rodent and was worried about a medication that the rodent had ingested and, those safety procedures around animal waste. So I'm super, super grateful to hear that. And also, again, to think about things like the American College of Veterinary Anesthesiologists that have these guidelines and being able to talk to your safety officer. And of course, on the MotherToBaby website, we do have information about radiation. We have a sheet about occupational exposures and specifically one for vets and vet techs as well. So really nice to hear this information really directly from the experts. So, Dr. Reefhuis and Dr. Rocheleau, thank you so much for being with us today. We're going to stop here, but we are going to continue later on with more questions about different occupations and exposures during pregnancy and breastfeeding. So we're very excited to have you here and cannot wait to have you back.
Thanks for having us, Chris.
Thank you so much.
And that'll do it for another episode of the MotherToBaby Podcast. Thank you, as always, for joining us in our listening audience. If you have an idea for the podcast, so if you have a question, if you have an idea for a topic, if you want to be on the podcast, please feel free to let us know. We love to have our listeners involved as much as possible. So if you want, you can email us at contactus@mothertobaby.org. And be sure to keep an eye out for follow-up episodes. So we are going to be talking about more jobs and exposures in pregnancy and breastfeeding. So things like working in a nail and a hair salon, things like working in a warehouse, for example. So we do have more great information to come. And in the meantime, feel free to go back through our old episodes of the podcast. So you can find us on iTunes, Spotify, or however you listen to podcasts. And don't forget to subscribe to the podcast so that way you never miss an episode. And of course, if there's any questions about exposures during pregnancy and breastfeeding, you can always contact MotherToBaby directly. So you can reach us by phone at 866-626-6847, by text at 855-999-3525. You can find us online at our website, MotherToBaby.org, not only where we have our podcasts available, but also our baby blogs, our fact sheets, and our online chat system, if that's how you want to reach us. As always, thank you for being a part of our audience. And remember, MotherToBaby is here for you. Take care.
MotherToBaby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about MotherToBaby, please visit MotherToBaby.org.